Jim, as I've traveled around the state this year, I've had a lot of questions about scope of practice bills. Can you give us an update what has been introduced in Springfield?
Yes, Dr. Werner, there are several bills that have been introduced in Springfield that address the scope of practice issue. Some of these bills actually expand the scope of practice of currently practicing professionals, while other bills initiate licensure for some new professionals in the healthcare field. For instance, one of the bills that's been introduced has been on behalf of the advanced practice nurses. Their bill would provide that the APNs can practice independent of any physician supervision. Currently, nurses have to practice with a collaborative agreement with the physician. This bill would take away that requirement, and it would also allow nurse anesthetists to practice unsupervised anesthesia services. Another bill that's been introduced on behalf of the psychologists would allow them to prescribe drugs to treat mental illness. Only 2 other states in the nation allow this so far. This bill would allow psychologists with minimal training to treat patients with serious mental illness. Another bill that's been introduced on behalf of the lay midwives. Now, lay midwives should be distinguished from nurse midwives who are licensed in the state currently as APNs. These lay midwives have no formal training, yet their bill would allow them to provide prenatal, delivery, and postnatal services to Illinois women. Another bill that's been introduced on behalf of an allied health professional to expand their scope of practice would be for dentists. The dentists are supporting a bill that would allow them to provide immunizations to their patients. No other state currently allows that right now. The naturopaths have introduced legislation, again in Illinois, to initiate licensure for them. Their bill would allow them to be called naturopathic physicians, and they would be permitted to practice naturopathic medicine. Again, another bill we're very much opposed to. And lastly, there's a bill that's been introduced on behalf of the colon hydrotherapists. Believe it or not, the colon hydrotherapists have been practicing in Illinois for many years. But just recently, the Illinois Department of Professional Regulation has threatened to close their offices because they are practicing medicine without a license.
Jim, it seems like some of these scope of practice bills get introduced every year. Every year the State Medical Society really is a representation for patients and for physicians in Springfield. How do you see these bills expanding in the future, if that would be the case?
Healthcare reform, I think, has given a lot of impetus to these professionals introducing these bills. There are some people in Springfield who believe that because of a supposed shortage of physicians, that these allied health professionals can step in and provide the care that physicians customarily provide. That, I believe, is a real danger to patient safety in Illinois, because we need to have qualified individuals who earn their degree in medicine and some other healthcare professions that are certainly well qualified to provide some care. But the inference that these individuals can practice through legislation rather than by education and training poses real risk to the general public.
And Jim, when I've spoken with legislators, I've raised this issue that would you ever lower the standard for practice to license a physician in the state of Illinois? And the response, of course, is absolutely not. But isn't that what these bills are doing?
You're right on the point, Dr. Werner. There's no question that these bills lower the bar for people to practice healthcare services in Illinois. We would never think of introducing legislation that would lower the education and training requirements for physicians. But if you examine these bills closely, that's certainly what they're doing. They're really lowering standards for these professionals to treat patients.
Well, Jim, this was a great review of the status of these scope of practice bills in Springfield. Now, what can our members, what can physicians do in terms of being an advocate?
Well, the most important thing I think a physician can do is get to know their local legislators. They are the people that are making these decisions. There are no physicians in the Illinois legislature, not one. And we can't expect our legislators to know everything about these issues without having physician input. Now, myself and my staff can certainly do some of that. But there's an old saying in Springfield, all politics is local. And therefore, it's important for physicians to build up those relationships with the local legislators to make sure that those legislators understand how these various proposals will not only affect physicians, but the care that their constituents receive.
And I found that when I have those conversations with legislators in the district, they want to hear the stories. They want to hear about how this will impact patients. And it oftentimes will have a great influence in terms of how they're now interpreting these scope of practice bills.
There's no question about that, Dr. Werner, because these legislators are often approached by these various professionals who are seeking these legislative changes. So, for instance, the nurses, the psychologists, the lay midwives, the naturopaths, the colon hydrotherapists will all be approaching their legislators, asking them to support these bills because they think that they're providing access to essential healthcare services. We must counteract those messages by saying that only physicians with their education and training have the ability to provide these types of very important and complicated healthcare services to Illinois patients.
And when I'm asked, isn't this just a turf war between the doctors and the other healthcare professionals, I respond that no, it's not. It's a patient safety issue. It's an educational issue. It's really a competency issue in terms of providing practice and services to patients.
That's an important message to deliver to legislators because patient safety is critically important to Illinois citizens.
You've heard from this conversation how important it is to have strong representation in Springfield on your behalf and on behalf of your patients. We need to have conversations with our legislators as well. You can find out information about these bills, the status of the bill, and the position that the State Medical Society has taken at our website, www.isms.org. There you can also find out membership information. It's very important that we have strong membership so that we can continue to have strong advocacy for you and your patients in Springfield. Thank you. I'm Dr. Bill Werner.